For the last 5 years, it was very obvious and clear that the heart disease in women is increasing. And that's maybe because of sedentary life, increase the rate of smoking, increase in the rate of body weight and body mass index. And my really advice for most of the women that they have to watch their weight, especially the waist circumference. And secondly, to do like regular medical checkup, because most of the diseases like high blood pressure, high blood sugar, high cholesterol doesn't have any or clear symptoms, they can notice it. So my really advice to do like a regular checkup and watch their diet and do more exercising and have a healthy life. Secondly, they have to take any pain in their chest more seriously and not lightly, because most of the pain in the chest is indicator of a very serious heart condition.
Regular visit to a dentist. I would say that to maintain good oral hygiene, visit your dentist at least once a year. Besides, this will help you maintain good, strong, healthy teeth, and chances are that any infection or any disease which is initiated can be detected in initial stages. So if you see any dark spots or lines on the tooth surface, it can be an indication of the cavity formation in the tooth. Now, be very particular in choosing and maintaining the dental cleansing aids. If you have been using your toothbrush for more than 3 months, then replace it with a new one as soon as possible. As soon as you notice the bristles of your toothbrush getting frayed, it is time for you to replace the toothbrush. Now, brush twice a day and rinse well. 75% of the dental problems can be solved if we brush our teeth thoroughly. Make sure that you brush your teeth twice a day for a minimum of 2 to 4 minutes to get rid of the plaque. Always clean your tongue as a part of your daily oral hygiene using a tongue cleaner. If you are a regular snacker, you rinse your mouth thoroughly after every snack. This is the bare minimum which you can do, since you cannot brush all the time. Now, gums should not bleed upon brushing. This is an indication of periodontal disease. Your dentist should do a thorough examination to evaluate the extent of disease and prescribe an appropriate regimen. Now, if you experience pain or sore muscles in the jaw or the joint area, especially in front of your ears, or even headaches, you may be grinding or clenching your teeth in your sleep. Speak to your dentist about being fitted with a night guard, which will protect your teeth and the joint area.
Maintaining good oral hygiene is one of the most important things you can do for your teeth and gums. Healthy teeth not only enable you to look and feel good, they make it possible to eat and speak properly. Good oral health is important to your overall well-being. Plaque. Plaque is the sticky, colorless film of bacteria that forms on teeth. Plaque develops when foods containing carbohydrates, sugars, and starches such as milk, soft drinks, raisins, cakes, or candy are frequently left on the teeth. Bacteria that live in the mouth thrive on these foods, producing acids as a result. Over a period of time, these acids destroy tooth enamel, resulting in tooth decay. Moreover, if plaque is left unremoved with daily oral hygiene, it accumulates layer over layer, attaches itself to tooth surfaces, and eventually harden into calculus or tartar. This scenario results in gum diseases like bleeding, recession, and bad breath. The good news is that dental disease is preventable. You can practice preventive dentistry on yourself by adopting these healthy habits like brushing, flossing, maintaining good balanced diet, and trying to schedule regular dental visits every 6 months with your dentist.
So I'm here to give you some hints about your skin health. First of all, don't expose yourself too much to sun, as it is dangerous and not good for your skin, not good for your health, and can cause a lot of skin cancers and photoaging. Always seek your dermatologist to use sunscreens before exposing yourself to sun. Secondly, try to drink a lot of fluids, a lot of water to hydrate your skin. Hydration can come from outside by using hydrating creams, and from inside by drinking a lot of water and fluids. Try to avoid cosmetics over the counter. Don't buy and use any cosmetic which is not under the recommendation of your doctor. Finally, I would suggest that you seek your dermatologist's consultation regarding your health of the skin. Check regularly your skin with your doctor, and avoid using hard soaps which can cause dryness of the skin and can cause irritation, itching, and a lot of other bad things.
Now with the summer approaching, you're all probably trying to shed those winter pounds. So today, I'm going to share with you a few tips to help you with your weight loss. The first thing you want to do is increase your fiber intake by having more whole grain products like whole grain bread, brown pasta, brown rice, oatmeal, and rye bread. Rye bread has a special type of fiber that actually fills you up instantly. Second, you want to try and consume more fruits and vegetables. Fruits and vegetables not only are high in fiber, but they have a high water content, which allows you to eat a bigger volume for lesser calories. Third, you want to try and increase your protein intake. Protein also keeps you full longer. Try to choose lean cuts of meats and trim any fats, like taking the skin off your chicken. Fats that are found in meat products raise your bad cholesterol, so you want to try and avoid them. Last, you want to also try and include healthy fats like raw nuts, avocado, flax seeds, olive oil, and canola oil, but cautiously because they contain a high amount of calories. So instead of having a cup of nuts as a snack when you're hungry, sprinkle it on your salad. And don't forget to stay active.
Some of the commonest problems that we see in an ear, nose and throat clinic are hearing loss, discharging ears, dizziness, sinus infections, snoring and hoarseness of voice. At City Center Clinic, we offer services to investigate such issues, and this center is fully geared to offer solutions to such issues. It is sometimes difficult to distinguish between an abnormal sensation in the body and a real symptom. And one of the commonest errors most of us make is to delay in reporting it to a healthcare facility. Early reporting not only leads to diagnosis in the earliest stage of a medical issue, but it simplifies its management such that it becomes possible to avoid complications due to neglect. I would now like to mention when one should consider reporting to a healthcare facility in case of some of the common ENT disorders. And these are as follows. Hearing loss and discharging ears must always be reported if there is presence of fluid or pus or pain in the ear, if you can't hear properly, if there's a foul-smelling ear discharge that appears scanty but never goes away, is a special case and must never be neglected, as it may indicate a serious disorder called cholesteatoma. Speaking about dizziness, attacks, nausea, vomiting, dizziness while turning the neck to any side is an important symptom to be reported. Recurrent colds, stuffy nose, chronic cough, unexplained fever, especially in a child, are indications of chronic sinusitis and must always be reported. Snoring, especially the loud snoring during sleep, may actually be a sign of obstructive sleep apnea, which is a serious disorder that deserves to be reported. Hoarseness of voice, any hoarseness that lasts longer than 2 weeks, especially when it is accompanied by cough, difficult swallowing, or blood in the sputum, must always be reported.
Disease of the gastrointestinal tract are as common as heart diseases. Many of these disorders are related to our lifestyle, including bad eating habits, lack of exercise, and stress. Examples of these disorders are fatty liver, obesity, and to some extent irritable bowel syndrome. Other significant illnesses can be avoided or cured if it is discovered at early stages, like colorectal cancer. This is done by screening program for people above 45 and 50 years of age, and even sometimes at younger age group if they are at high risk. The gastroenterology and hepatology department at City Center Clinic offers diagnostic and therapeutic service in almost all GI and liver disorders. One of the common disorders, as we mentioned above, is irritable bowel syndrome, which is a functional disorder of the GI tract, and it is characterized by abdominal pain, bloating, distension, constipation, diarrhea, or both. It is not a dangerous disease, it is a syndrome, but it interferes with social life and your work as well. But there is good treatment available. It's a combination of lifestyle modification, diet, and regular exercise. And there is a lot of recent medication which helps you. We have to try to reduce the stress and anxiety by simple meditation, relaxation, and to take it easy at life.
We'll talk today about the gallbladder stone. The gallbladder stone are a small stone located in the gallbladder. It causes sometimes severe pain, inflammation, cholecystitis, etc. The treatment of the gallbladder stone are mainly is laparoscopic cholecystectomy. This meaning we are using 3 to 4 holes inside the abdomen to reach the gallbladder and remove it. This surgery it takes about half hour. The patient will discharge in most of the time at the same day. We have a new surgery which consists of one incision. It's one wound only. It's located near the umbilicus. It's about 2 centimeters, and the patient also will discharge at the same time. Single port laparoscopic cholecystectomy is a very easy or simple surgery, and it's better from laparoscopic surgery.
Talk to your doctor about taking aspirin for heart protection, but don't assume that it's right for you. Be aware that aspirin has some serious risks, including gastrointestinal bleeding. Drink water no matter where you are. Water should always be the first thing you reach for when you are thirsty. Water truly is essential. Sleep 8 hours a night. A number of recent studies have confirmed that you really do need at least 8 hours a night. Among the many benefits, adequate sleep makes you feel better, decreases risk for cardiovascular disease, boosts memory. Don't drink too many calories. It's easy to drink too many calories without noticing.
Women should do regular pap smear at least once in 3 years from the age of 25. Pap smear is a screening test which helps detect early changes in cervix and thus helps in prevention of cervical cancer. Women planning for a pregnancy are advised to take folic acid supplements at least 3 months before conception. This will help prevent neural tube defects in the fetus. Women above the age of 40 are advised to take calcium supplements and do regular weight-bearing exercises. This helps maintain bone density and prevent osteoporosis. Women should have a mammogram when they reach the age of 40 and then on regularly, the frequency depending on their individual risk.
Computer eye strain. With so many of us using computers at work, computer eye strain has become a major job-related complaint. Studies showed that eye strain and other visual symptoms occur in about 50 to 90% of computer workers. These problems can range from physical fatigue, decreased productivity, and increased number of work errors. Sometimes patients come complaining of eye twitching, even red eyes. There are 10 steps to relieve computer eye strain. Number 1, get comprehensive eye exam. Go to your doctors, let him check your eyes and tell you whether you need any proper arrangement before using the computer, using glasses and some other advices. Number 2, use proper illumination. So, for example, the window or the bright light not to be in front of your eyes or behind your computer. Get them on your side. Arrange your desk to be in a proper way, not in front of bright light, not the bright light behind you. Number 3, minimize the glare. Avoid any bright object in front of or on the side of your computer without projecting the bright light on your eyes. Upgrade your display. Number 5, adjust your computer display setting. Brightness, text size, contrast, color, all those can be adjusted in a way comfortable for your eyes. For example, increase the text size so you can comfortably see and not to strain your eyes looking to the small print. Number 6, blink so often. Each time you blink, you distribute the tear film over your eyes, and that will decrease the strain on your eyes. Number 7, exercise your eyes. Every 10-20 minutes, stop the computer and move your eyes in different direction. Up right, up left, down right, down left. Look far, look medium, look near. That will change the focus of your eyes and decrease the strain. Number 8, take frequent breaks. Every 20 minutes, move around. 20 steps, takes 20 steps. That will improve the circulation in your legs, decrease the focus of your eyes, decrease the strain in your eyes. Number 9, modify your workstation in a way you are comfortable. Your sitting should be comfortable, illumination should be comfortable. Consider using computer eyewear if necessary. That will be advised to you by your doctor, whether you are farsighted and need some helping eyeglasses, bifocal eyeglasses, and some other advices.
The biggest dilemma that we parents have is how to make our kids eat healthy. The key to that is start them young. Food preferences are developed early in life, so offer variety. Likes and dislikes begin forming even when the kids are babies. You may need to serve a new food on several different occasions for a child to accept it. Don't force a child to eat, but offer a few bites. With older kids, ask them to try one bite at a time.
Liposuction is not only an aesthetic procedure but also improves health condition by reducing cholesterol, blood pressure and sugar in the blood. Breast surgery is one of the most common surgery in the world because it improves the look of breasts as it is an important part of femininity and ladies' beauty. Body reshaping after losing weight is one of most popular in UAE and also all around the world and is considered as one of most safe aesthetic procedure. Botox is safe and fast way to improve your face appearance without wrinkles.